1. Drug class. Amiodarone is a Class 3 antiarrhythmic drug, according to the Vaughan-Williams classification. 2. Mechanism of action. Amiodarone primarily works by blocking potassium K channels, which prolongs phase 3 repolarization, increases action potential duration, prolongs the refractory period in cardiac tissue. It also has additional actions. Mild sodium channel blocking, Class 1 effect. Beta blocking activity, Class 2 effect. Calcium channel blocking, Class 4 effect. Right arrow. Because of these multiple actions, amiodarone is effective against many types of arrhythmias. 3. Effects on ECG. Prolongs QT interval. Prolongs PR interval. Slows heart rate. 4. Pharmacokinetics. Route, oral and intravenous. 4. Bioavailability, variable. Highly lipophilic. Very long half-life, 20 to 100 days. Metabolism, liver, CYP450 enzymes. Elimination, biliary, minimal renal excretion. 5. Indications/uses. Amiodarone is used to treat life-threatening arrhythmias, including ventricular tachycardia, VT. Ventricular fibrillation, VF. Atrial fibrillation. Atrial flutter. Supraventricular tachycardia, SVT. 6. Dosage, general overview. Oral, loading dose followed by maintenance dose. 4. Emergency used in cardiac arrest and unstable arrhythmias. Warning: exact dosage depends on clinical condition and patient response. 7. Adverse effects/side effects. Amiodarone has many important side effects, especially with long-term use. Cardiac. Bradycardia. QT prolongation, rare torsades de pointes. Pulmonary. Pulmonary fibrosis, serious and potentially fatal. Thyroid. Hypothyroidism. Hyperthyroidism. Due to high iodine content. Liver. Elevated liver enzymes. Hepatotoxicity. Eyes. Corneal microdeposits. Optic neuropathy, rare. Skin. Photosensitivity. Blue-gray skin discoloration. Neurological. Tremors. Ataxia. Peripheral neuropathy. 8. Contraindications. Severe sinus bradycardia. AV block, without pacemaker. Thyroid disease. Severe liver disease. 9. Drug interactions. Amiodarone increases levels of warfarin, digoxin, phenytoin, statins. Right arrow. Dose adjustment and monitoring are required. 10. Monitoring parameters. Patients on amiodarone should be regularly monitored for ECG, chest X-ray/pulmonary function tests, thyroid function tests, T3, T4, TSH, liver function tests, eye examination. 11. Special points, exam tips. Contains iodine. Very long half-life. Effective for both atrial and ventricular arrhythmias. High toxicity used when other drugs fail.